Good evening. My name's Julia Bean.
I'm Jackie Therrien.
Ellie Doyle. Elisa Marinella.
And we'd like to welcome you to our presentation and thank you for taking the time to join us this evening. Right now we're going to present our research titled The Therapeutic Effects of Kinect for Xbox 360 in Rehabilitation of Children with Disabilities. When researching the justification of our study, we discovered various sources about children with disabilities. Some of this information included risks such as not participating in physical activity, as well as low self-confidence and self-esteem. As physical therapists, it's within our scope of practice to employ skilled interventions for children with disabilities in order to improve the prevalent limitations of balance, gross motor skills, and quality of life. With the leaps and bounds that have been made in the realm of technology recently, many rehabilitation professionals have been reassessing their interventions. One area that has been specifically researched is virtual gaming technology. Studies have shown that virtual reality games, specifically the Nintendo Wii, increase motivation in children. Specifically, research has found that in children diagnosed with Down syndrome, the Wii improved fine motor integration, upper limb coordination, running speed, and agility proficiency. Another study showed that in children with cerebral palsy, the Wii improved postural control as well as functional mobility. Also, active video gaming in the rehabilitation of children with special needs has fostered feelings of self-determination, independence, and improved quality of life. So based on all of this research, we hypothesized that we would see all of these results and possibly more due to the controller-free accessibility of the Kinect for Xbox 360. So with all this research on the Nintendo Wii, you may be asking, but why the Kinect for Xbox 360? One of the major benefits of the Kinect is that no handheld controller is needed. The Kinect utilizes a motion-activated sensor, which allows players to control the video game with different hand motions. When the Kinect was released on the market, Microsoft recognized the vast implications of this state-of-the-art technology and coined the term Kinect effect. One of the Kinect effects that Microsoft discovered was that families with children with mental or physical disabilities are able to use the controller-free Kinect and have fun with their siblings for the first time ever. This was a huge push for us, why we really wanted to investigate the uses of the Kinect. The Kinect is currently being used by various rehab programs as a new and exciting intervention. An extracurricular gaming program with children in a public library showed improvements in social interactions, hand-eye coordination, learning and memory skills, pattern recognition, as well as self-confidence. Also, a stroke rehab pilot program at the Royal Berkshire Hospital in the United Kingdom utilizes the Kinect currently to regain mobility, coordination, and balance in these patients. However, we found that no empirical evidence exists on the effects of Kinect for Xbox 360 in children with balance, gross motor skills, and quality of life impairments. Therefore, the purpose of our study is to determine the effects of Kinect for Xbox 360 as an adjunct to rehabilitation on balance, gross motor skills, and quality of life in children with varying disabilities.
Children with a range of disabilities were recruited to participate in our study. All of these children were or are currently receiving physical therapy from Cheshire Fitness Zone. And recruitment occurred through coordination with the clinic's owner, Craig Goldstein, and via a flyer that was posted in the clinic. All subjects were screened to determine if they were appropriate to participate based on their individual conditions. And therapists also made recommendations as to candidates they thought were appropriate. For the subjects that were selected, consent was obtained through the parents and through the individual subjects verbally, using consent forms from the parents. A total of 5 subjects were recruited to participate in this study based on the listed inclusion and exclusion criteria. We just needed to make sure that the subjects were able to stand to participate in the games and were able to communicate with our student therapists appropriately. And they were not allowed to participate if they had any medical contraindications to exercise. The 5 subjects that we chose ranged from age 6 to 11. There were 4 females and 1 male, and the diagnoses they had ranged from 2 forms of cerebral palsy, right-sided hemiplegia, an undiagnosed chromosomal disorder, and muscular myotonic dystrophy. This is just an overview of our procedure. Our study took place at Cheshire Fitness Zone, and the design that we implemented was a quasi-experimental design that obtained outcome measures for each subject at baseline and post-intervention. The tool that we used was the Kinect for Xbox 360, and the 3 outcomes that we assessed were balance, gross motor ability, and quality of life. So the outcome measures that we used were the pediatric balance scale, the basic gross motor assessment, and a self-made quality of life survey. During each session, 2 physical therapy students worked with each individual subject while supervised by a licensed pediatric physical therapist, Craig Goldstein. And the children were assessed for each outcome measure at pre-test and at post-test by the same physical therapy student. The assessors were also blinded at post-test to the baseline results. So the pediatric balance scale was the outcome measure that we used to assess balance. It's a modified version of the Berg balance scale used in the adult population, and it's a 14-item test that scores the subjects on a 0 to 4 scale. Scoring is based on the amount of assistance needed and supervision needed, the amount of time needed to complete the activity, and overall completion of the task. And tasks included in this test involved both static and dynamic activities in both the sitting and standing positions. And the test has been shown to have good reliability when used with school-age children with mild to moderate motor impairments. The Hughes Basic Gross Motor Assessment was used to assess gross motor ability in our subjects. This test is used to evaluate children with minor motor problems, specifically between the ages that are listed there. And the child completes 9 gross motor tasks, such as hopping, skipping, and jumping, and is scored based on the deviations noted for the tasks. If the subject is 6 years old, 2 of the more difficult tasks were not performed. And this test has been found to be both valid and reliable. The last outcome measure that we used was a self-made quality of life survey. It consisted of 8 items using a Likert scale format, and it was scored based on the parent's perception of his or her child's quality of life, and consisted of questions regarding social skills, state of well-being, levels of motivation, levels of activity, and levels of enjoyment of exercise.
So for our intervention, it was obviously using the Kinect for Xbox 360. What we did is we met with each child once a week for 45 minutes, and this lasted for 7 weeks. We let them choose which games they wanted to play, and the games were Just Dance Kids 2, Kinect Sports, and Kinect Adventures, and they were allowed to pick which games within those games they wanted to play. We also let them decide when they were ready to switch to a new game throughout the session, and we also let them pick, if it was an option, whether they wanted to play by themselves, with us on their team during the game, or against us. We actually found in our research that giving them choice increased motivation, and we also along the way gave them lots of verbal cues and lots of encouragement to try to make it as fun as possible, but also to get them to participate as much as they were able. And on average, per session, they played 3 or 4 games each session. So we made this nice little chart. These are all the games that we played. We separated out the sports games, which you can see are the top 6 ones, and then underneath is the Just Dance Kids 2 and the Kinect Adventures. We noticed that different games really worked on different skills. So this, you can see the different skills that we found were coordination, balance, weight shifting, step initiation, jumping, dissociation, muscle endurance, upper extremity movement, kicking, cardiovascular endurance, and reaction time. The games that were played most often were the Kinect Sports and Just Dance Kids. And of the Kinect Sports game, bowling and soccer were favorites, so those were played a lot. Go ahead. So these are some of our subjects. As you can see, they worked on a lot of the skills we talked about. The first picture, she's working on dissociation. She was actually playing the Just Dance game, and you had to follow along with whatever the screen was doing, and a lot of it was dissociating upper body and lower body and both sides of the body. The middle picture is one of our subjects. He's working on kicking. He was playing the soccer game. For him, these pictures are from our last week, but when we first met him, he had a lot of trouble even picking up his feet, and his balance standing on one leg was not good at all. So for him to be able to kick in a pretty normal pattern was a huge thing. And then the last picture, you can see coordination. That's also the Just Dance game, and it's all time also, so you have to do it along with the game, and you can see our subject is doing it at the same time as Elisa, so that's good. These ones, upper extremity movement, that was bowling. Weight shifting, I don't know what game she was playing there, but I think might have been bowling. And the last one, social interaction, they all loved playing with us. As you can see, Dylan and Elisa are giving each other high fives after playing an awesome game. So, as far as data analysis, we use a Wilcoxon sign rank test. We use SPSS to do our data analysis. We chose an alpha level of 0.05 to compare our results to. For the balance scale, we were able to use the raw scores that we got from their scores. But for the basic gross motor assessment, we had to take percentage scores. Like Jackie said earlier, if they were 6 years old, there were 2 tasks that were too hard. So in order to compare all the subjects together, we had to take percentage scores. And then for our quality of life survey, we did a qualitative assessment. So these are our results, which were very good. All of our subjects improved on our pediatric balance scale, as you can see. I think the purple is the one that improved the most, but they all improved. And as you can also see at the bottom, we had statistical significance. Our p-value was 0.042, which is good. And then for our next one, which is the basic gross motor assessment, this looked at gross motor function, and all of our subjects also improved. And our p-value is also 0.042, which is statistically significant. For our self-made quality of life, the way that we did this is we looked at the results from pre-test to post-test, and if the majority of subjects improved, we said that it was an improvement. So the items that improved were motivation to participate in physical activity, attitude about his or her abilities, confidence in his or her abilities, and initiation of physical activity. So these were all based on the parents' perception of their child, but we thought that they were good things to find. Unfortunately, some of our tasks did not improve. Those are social skills with his or her peers, enjoyment in participating in physical activity, participation in physical activity outside of PT, and frequency of pain complaints.
We found statistically significant improvements in balance for all of our subjects. This is similar to current research that has been done by Gil Gomez, Taylor, Rahman, Deutsch, and Zettergren. Taylor found that after a WE intervention program, that coordination, balance, and quality of life improved. Deutsch found that after a WE intervention program in a 13-year-old with cerebral palsy, that center of pressure sway, medial, lateral, and anterior-posterior weight shift improved along with walker reliance. Rahman found that after a WE intervention in children with mild to moderate mental retardation, that balance improved. And lastly, Zettergren found that after a WE therapeutic intervention, weight shift and balance improved in a patient. We also found statistically significant improvements in gross motor skills, and this was in all of our subjects. This is similar to the findings by Wang. Wang found that in subjects with Down syndrome from the ages of 7 to 12, that running speed, agility, motor proficiency, and coordination improved. He also found that the ability to adjust movements and make modifications to movements also improved. We believe that these improvements in balance and gross motor skills occurred because we specifically chose games that targeted activities that would improve these skills, such as coordination, weight shifting, jumping, kicking, upper extremity movement, and reaction time. We also found that several items on our quality of life self-made survey also improved. These include motivation to participate in physical activity, attitude about his or her abilities, confidence in his or her abilities, and initiation of physical activity. These are similar to current research done by Gil Gomez and Taylor. Gil Gomez found that after WE therapeutic intervention, that feelings of self-determination, independence, and quality of life improved. And Taylor found that after WE intervention, that activity level and quality of life also improved. Taylor also found that when subjects were taking part in these virtual reality gaming systems, that they were so immersed in the game that they forgot about their disabilities and really focused and adhered to the physical activity. So as I just said, we found a lot of great results with this study, but one of the more rewarding things that we discovered was the positive feedback and how much the parents and the children really loved this program. One of the most important quotes that we heard from a parent was that her child really likes the Kinect better than the Wii because she has trouble with the controllers on the Wii. And this was huge for us because one of the main reasons why we wanted to do this project was because we knew that it had the potential to be even that much better than the Wii because the controller-free aspect of it. So unfortunately, our study did have some limitations. As you can see up there, one thing that could be fixed for the future is a larger sample size. This was a pilot study, so we only had 5 subjects, so getting more kids involved would be a great thing to do. Also, involving a control group would also be great to ensure that the improvements made were solely from the Kinect, and blinding of the therapists and assessors. And this leads into what we can do for future studies. We thought it would be very interesting to look at the energy expenditure that the children were doing while they were participating in Kinect therapy. We also thought it would be interesting to look at alternative outcome measures. As we said before, we looked at balance, quality of life, and gross motor skills, but looking at some other physical therapy skills would also be very interesting. Also, we thought it would be huge to look at the social interactions that this could possibly have. We had an idea of doing a group therapy, so taking the disabled children that we had and putting them with other children with disabilities, or also typically developing peers. And we also thought of having a more homogeneous subject population. As we said earlier, our 5 subjects had a wide variety of different diagnoses, so it might be interesting to choose one and see the results from there. So, in conclusion, we found that Kinect for Xbox 360 is a viable tool as an adjunct for rehabilitation in children with disabilities. It has many wonderful clinical implications such as improvements in balance, quality of life, and gross motor skills. It has additional benefits such as the controller-free use, which is unlike any other virtual reality gaming system on the market right now. It's great for a home exercise program because it promotes voluntary physical activity outside the home, and it's inexpensive, and it is easily accessible, and it's very interactive for not only the child but also for their family and friends. And lastly, it increases motivation and enjoyment. It improves social interactions with not only children with disabilities but also their typically developing peers and siblings.
So before we accept any questions, we just wanted to thank Craig Goldstein for being our advisor throughout this entire endeavor. We also want to thank the Institutional Review Board, of course, for approving of our study so we could look into this, and Tracy Wall for all of her help throughout the final weeks of this project. Are there any questions? Done?
What is cost? What is cost of the Kinect?
Craig?
I don't know. But we were,
About $400?
and we were kind of thinking that, you know, a lot of these kids already had stuff in their homes, whether it be the Wii or a regular video gaming system, where it's feasible for these kind of kids' parents to get it for them.
Or
Also-
if they already have the Xbox, all you need to do is purchase the Kinect system, which I know there are a lot of popular games on just the Xbox 360, so all they would have to purchase is the sensor and whatever games they want to play, which a lot of kids are unfortunately staying indoors and playing video games, but at least this is an interactive one that gets them moving and can improve some impairments.
Also, we finished in November, and a lot of the parents in our study told us that they were getting their kids Kinect for Christmas. So that was really exciting that they were going to keep going.
The other thing, you mentioned that your limitation in your study was the limited sample size of 5. It really wasn't a limitation in your study because you got statistical significance, and the sample size is already factored in the statistics. So 5 was an appropriate number for that study.
It just leads to possible future
Yeah, you're
research that could be done.
qualitative.
So do you think that the results on your social interaction would be different if they had these systems already at home? Because if they're just using them in the clinic, then maybe they're not using it as a social tool, but if it was at home, they'd be playing with their siblings or their friends.
Definitely. When we were first coming up with our idea for this study, we found another study that they did use group therapy, so we're like, oh, let's do that, but it was just like too many factors, especially since it was a pilot study, so I think that would definitely be the next step. We would like to see how that could improve social interaction, just playing with their siblings or their friends, and even there were kids in the clinic that would like run over and want to play the Kinect. We're like, oh, sorry, you can't play right now when we're done. So it definitely could be a viable option for a future research.
Something else that was really cool too is a lot of the therapists in the clinic started using the Kinect even after our
As an intervention.
as an intervention with other kids.
It is definitely,
Which was pretty cool to see.
It is challenging though for anyone. There's an ice skating game. You're squatting, you're doing your turns and stuff.
It was work, yeah.
It is. It is a lot of hard work.
I have like 2 questions, and I don't even know if I'm going to say this right. But so you first had mentioned how there wasn't really much of a change in like their feeling of their social interaction with their peers. How do you feel like it would have impacted if you did have like someone else like join in with them? Because I know you guys mentioned that you were cueing them. Do you feel like you would have then, if that would have interfered, how do you think they would have responded? Would that have been positive, negative? I don't know. What do you think?
I was going to say that it's interesting. It depends on the kid, because one of our subjects really liked playing with us. Another one really didn't. She always wanted to play by herself. And sometimes we would do like turn taking to give her breaks when she needed it. But and we kind of also, I noticed with one subject I was working with that he kind of did better when we played with him on a team as opposed to against him, because he got a little frustrated. So I think it depends on the child, and it depends how you set up the program and how you set up the encouragement, because sometimes that is a problem that they could get discouraged if they're working with normally developing kids.
However, in our research, some research also found that by playing with a typically developed child, they're trying to mimic their motion. So then it makes them work harder and get closer to a typical pattern of movement. So it's kind of, more research needs to be done.
And also, I think it makes them feel a little more normal because they can play the same game as a typically developing child.
I was going to say, if the future research was going to be done with a more homogeneous subject group, it would depend on like the diagnoses. Maybe it would be a more like social group of kids with certain diagnoses, and I think that could definitely help with the results for social interactions. What were you going to say, Jackie?
It's more of a comment, but in regards to social, being more social, I feel like you were almost in the right track because that all comes down to confidence, and you were building their confidence and their ability to do things. They'd be more likely to want to be involved in gym class or something like that. They felt like they could participate more. I think that's something that you gave to them.
Yeah, definitely. Anybody else?
Okay.